Hello, my name's Annette, and I'm going to go over the instructions on what to do now that you've had cataract surgery. The first thing we're going to go over today are the instructions for the eye drops. Everything I tell you this morning, you'll get an instruction sheet for, so you'll have something to reference back to, and so you don't have to remember anything this early in the morning. On the back of the instruction sheet is a checklist for the eye drops. The checklist will take you through the entire month. You do want to hold on to this. We're going to go over the instructions for what to do with the drops this week, but every week the instructions for the drops will change. You won't be coming back here every week, so this is what you'll have to reference to as the instructions keep changing. For today, I want you to use all 3 eye drops 4 times a day, 5 minutes apart. That's the 2 drops you started prior to surgery, as well as the one you were told to save for after surgery. The new one, the prednisolone acetate, the one you were told to save for after surgery, it is very important that you do start that drop today and that you are using it all 4 times. When we get those patches off, your vision's going to be blurry and distorted from the swelling in the eye. That's completely normal. Unfortunately, it will continue to remain blurry and distorted until that swelling goes down. This new drop is what's going to relieve that swelling and ultimately improve the vision. When you start using that drop, you want to shake it really well. All of the medication's at the very bottom of that bottle, so if you're not shaking it, the medication isn't actually getting in your eye. If you are shaking that drop correctly, the medication will be a white milky drop, so you may get some white milky discharge. That's perfectly normal. That's not the sign of an infection or an indication of a problem. You need to continue using that drop even if you do get the discharge. The next thing we're going to go over are the restrictions. As with any surgery, cataract surgery does have some restrictions. Dr. Oberlander has 3 main restrictions, all of which are in place for the next 2 weeks. The first is that you do not rub the eye. As the eye heals, that lens will heal into place. In the meantime, until the eye heals, it's actually possible to dislodge the lens by rubbing the eye. During the day, you don't have to wear anything over the eye. You just want to do the best you can to remember not to rub the eye. Inside the post-op kits I'll be handing out shortly will be a clear eye shield and a roll of paper tape. You want to use those whenever you're sleeping. If you're taking a nap during the day or going to bed at night, they're going to prevent you from rubbing your eye in your sleep. As your eye heals, it's likely to feel itchy, irritated, a sandy or gritty feeling, some mild irritation, and frequently a lot of watering. That's completely normal. Unfortunately, it is going to make you want to rub the eye. So it is important that you are wearing your shield every night so that you don't rub it in your sleep. You only have to wear the shield for the first week. That's when the irritation's at its highest point. The next restriction is that you keep the eye as clean and dry as possible. An infection after any surgery is something serious. An infection after eye surgery can't be fixed with drops or with pills. It always means more extreme measures. So we want to do everything possible to prevent an infection in the first place. One of the drops you're on is an antibiotic drop. That's going to help prevent an infection. In addition, you want to make sure that you're washing your hands before you put the drops in. If someone's helping you with the drops, make sure they wash their hands as well. If you dab at your eye, you want to use a clean tissue right out of the pack. No cloth napkins, no handkerchiefs, nothing that have been tucked in pockets or purses. Just a clean, fresh tissue every time. If you touch your other eye or your nose with that tissue, you want to throw it away and get a new one before you touch that eye again. You also want to keep the eye as dry as possible. All water's dirty, so for the next 2 weeks, there's no swimming, no hot tubs, no water aerobics, nothing that can lead to a splash in the face. You do want to use extra caution when you're showering or bathing. Take a damp cloth and go around the eye. Don't splash your face. Don't stand directly under the spray. Starting today, it is okay to resume all normal hygiene practices. It's okay to shower, it's okay to bathe. There are no restrictions on any of your hygiene practices. We just want you to use a little extra caution when you are performing them. The only other restriction is you want to be careful how much you're picking up. Dr. Oberlander sets the weight limit at 10 pounds. That's about the weight of a gallon of milk. For the next 2 weeks, he'd prefer you didn't lift anything heavier than that. Now on the sheet of instructions, it does say no bending and lifting. It's the combination that's of most concern. If you need to bend over and feed a pet, pick up a newspaper, tie a shoe, all of that's perfectly fine. We just don't want you bending over and picking up anything heavy. The next thing we're going to go over is our emergency number. It's very unusual for Dr. Oberlander to have an emergency, but we want to make sure everyone knows what to do just in case. An emergency is any sharp, intense pain or any sudden loss of vision. If you experience either of those two things, we do want you to call us right away. Our doctors are on call 24 hours a day, 7 days a week, and generally in eye care, the quicker the response, the more likely it is they can save your vision. Our emergency number is written on the sheet of instructions about halfway down the page in a dark bold font, but it is the same number as our usual line. So if you can't find the sheet of instructions and you do have a problem, whatever number you usually use to reach us will get through just fine. The last thing we're going to go over today is the vision. As I said in the beginning, your vision's likely to be blurry and distorted from the swelling in the eye. As that swelling goes down, your vision is going to continue to improve. It will fluctuate from day to day and sometimes throughout the day. Because your vision will keep changing, Dr. Oberlander will not fill out any paperwork requiring a final vision or write any new prescriptions for glasses until your 1-month appointment. In the meantime, some people find they need something to get them through the next month. The majority of your lenses are set for distance vision, so some people find they need something to help them read closer up. He recommends over-the-counter reading glasses. You want to try them on in the store. What worked in the past might not work now. In addition, you don't want to spend a lot of money on them. What works today might not work tomorrow. That is completely optional. You do not have to make an additional purchase. At your 1-month appointment, anyone that requests or requires a glasses prescription will be given one at that time. If you currently have prescription glasses, it is perfectly safe to continue wearing those. Your prescription is changed and is no longer accurate, but it will not cause any damage to your eye to wear the wrong prescription. For some of you, though, your prescription has changed so much that wearing your glasses can make you feel dizzy, disoriented, or it's just blurrier with them on than with them off. If that is the case, you can take your glasses to the optical department at no charge to yourself. They'll remove the lens. That way you'll still have the lens for the other eye.